You know, there are several reasons we lose height as we get older, and for most of us, this is something we'll notice once we get into our late 30s or early 40s. In fact, by the time we get into our 80s, most of us will end up somewhere about 2.5 to 3 inches shorter of what we used to be. That's quite a bit. So I'm going to go over a few reasons why this happens, mostly focusing on the spine, and I'll share a few tips that might help you stay a little bit taller, a little bit longer.
I'm shrinking.
Hi, I'm Dr. V. Welcome back to the channel. This video is all about why we get shorter as we get older. But first, did you know that you get shorter throughout the day? Now, I'm not talking about just a little bit either. In a single day, from the time that you get up in the morning to the time that you go to bed, you'll lose somewhere between 1/2 inch to 3/4 of an inch. Now, most of this has to do with the effects that gravity has on the spine. When we're in a vertical position, sitting or standing, gravity compresses the spine, and this causes the vertebral discs, which are mostly made out of water, to also compress. When you're in this position for several hours, the disc will lose enough water due to the compression, enough to where you see this height change by the end of the day. Of course, this is just a temporary thing because the opposite happens when you're in a horizontal position. If you're laying down or when you're asleep for several hours, the discs gradually recover and have the ability to rehydrate themselves. This is all just part of the normal dynamics of a healthy spine. Question is, what happens if the discs don't hydrate themselves as well as they used to? Well, that's one of the reasons why we tend to lose height. You see, we have 23 discs in our spine that make up 25% of your total vertebral height. As I mentioned earlier, they're mostly made out of water, about 90% in a young, healthy spine. Now, these discs are pretty tough. They're not indestructible though, and they do have their limits. So they're prone to injuries and normal wear and tear over the years. So gradually they do lose their ability to hydrate this, which means that they start to thin and we start to get a little bit shorter. Now, aging is one thing, but there are other factors that can actually accelerate these changes. And these are the things that we want to be aware of. I've seen plenty of younger patients in their 20s or even 30s whose spine looks twice their age on an X-ray or an MRI. For example, this MRI here shows several discs with a lighter shade of color. This brighter signal you see here are an example of what a hydrated disc would look like on an MRI. But if you look at this one here, you'll notice it doesn't really look like the others. It's much darker in color. This is what a dehydrating or a desiccating disc looks like. It's also not unusual to see a bulging or herniation with these discs. Now, this can happen for a variety of reasons. Some due to genetics, others may be due to old injuries, car accidents, contact sports, lifting injuries, things of that nature. There are other factors that are more lifestyle based, like continual use of tobacco products, not staying hydrated well enough, or even repetitive stress or strain like you would see in chronic bad posture.
Oh, sit up straight, honey.
Now, these all have an accelerating effect on the aging of the disc, but the bones themselves can also contribute to height loss through something called demineralization, which is what you see with osteoporosis. Now, osteoporosis is something that affects both men and women, but it affects women much more than it does in men, which is one of the reasons why women tend to lose a little bit more of their height relative to men. By the way, I really want to mention that over half of the population of those who have osteoporosis will suffer a severe fracture in their life, either in the hip or a compression fracture in the spine. So it's extremely important to understand osteoporosis and what it is that you can do to help keep your bones strong and healthy. I have another video on osteoporosis you might want to take a look at. I'll put a link towards the end of the video. So let's go over a few tips that can help you stay taller a little bit longer. One, stay hydrated with water. And I don't mean drinks that contain mostly water like coffee or tea. I mean water. As a general rule, you want to aim for half your body weight in ounces throughout the day. In other words, if you weigh 150 pounds, aim for 75 ounces of water per day. Now, if you do drink, say, coffee, tea, or anything that's caffeinated, add an equal amount of what you drank to your daily goal. So if you drank 8 ounces of coffee, make sure you add an extra 8 ounces of water to your daily goal. Get a good night's rest. Try sleeping on your back with a pillow underneath your knees to maintain the natural curvature of your spine. This position helps reduce the pressure on your lower back. Now, if you sleep on your sides, put a pillow between your knees to keep your hips aligned, and this will help reduce some of the stress and strain in the pelvis as well as the spine. Avoid sleeping on your stomach. Now, remember, the goal when you're sleeping is to maintain a neutral position of your spine, and sleeping on your stomach just doesn't cut it. Exercise regularly, particularly strengthening the core muscles with planks or bridge exercises. Focusing on the extensor muscle groups to help strengthen your postural muscles can be very helpful. Also, and I know this might be a little bit tougher, but try to maintain a healthy weight. Avoid tobacco products and always practice good posture. Well, that's all I got for this short video. Don't forget to click on the buttons below if you like this type of information. Take care and keep your head above your shoulders, and I'll see you back next time.